Today's hearing is about excess costs in healthcare and ways we can reduce the budget by spending healthcare dollars more efficiently. As I point out often, and as this graph shows, the U.S. continues to spend more on healthcare as a percentage of GDP than any other peer OECD country. And at the same time, the vertical graph is life expectancy, and average life expectancy in this country is lower than that of most of our peer countries, parallel to Estonia. We're spending $4 trillion a year, and the Centers for Medicare and Medicaid Actuary estimate that health spending will grow to 20% of GDP by 2031. Not only is our life expectancy in America lower than you'd expect compared to other OECD countries for all the money we spend, but it has actually declined over the last 2 years. And Americans' life expectancy is now the lowest it has been in 2 decades. Put very simply, we get very little bang for $4 trillion. It is grim, but there are some signs of progress, and we'll hear today from experts about how we can do better. CBO has found that federal health care spending between 2010 and 2020 was more than $1 trillion lower than CBO had projected prior to implementation of the Affordable Care Act. And as this chart shows, CBO now projects the U.S. will spend $4.6 trillion less on the major federal health programs, mainly Medicare and Medicaid, over the next decade than was projected pre-ACA. While there are many contributing factors, the deceleration shows that smart policymaking and reforms can help bend the cost curve. But our work isn't done. That's because our fragmented and endlessly complex healthcare system creates the perfect environment for inefficiencies to fester. It is where excess costs live and grow.